Tonight on The Health Show, falling. It's no joke, especially for the elderly. Erica Johnson with some advice on how to stay on your feet. Some of us fall out of love. Some of us fall out of favor. Some of us fall out of bed. Some of us fall from grace. But it's the most common, everyday kind of fall that actually has the biggest impact on our health. Here's Erica Johnson to tell us about falling down, and with any luck, getting back up again.
It can look pretty funny. People lose their balance and their feet fly out from under them. Sometimes, if you've got a ringside seat, it can be hard not to laugh. But falling can actually be very serious, especially for seniors. Last year in Canada, 85,000 seniors slipped, tripped, and stumbled their way into hospital beds. More than half of those seniors died.
It's much more serious for the elderly when they fall because of their likelihood of suffering a more serious injury.
Falling when you're young isn't a concern because the bones are full of calcium. But as we age, our bodies make less calcium, so our bones become brittle. So why do we fall? Well, we stumbled across an area of research called dynamic posturography. Now, basically, that's a fancy name for work that involves this gizmo behind me. This platform jerks forward and backward and sways side to side. It's like being on a bus with no shocks. Human guinea pigs are hooked up to a computer that measures how people brace themselves, which muscles they use, and where they distribute their weight. This man built the platform. He spent the past 10 years studying balance.
We know that special receptors on the soles of your feet sense the pressure that's acting on your feet, and that this information is sent through the nerves up to your brain, and that your brain uses this information to help control your balance. And we also know that as people grow older, their ability to sense pressure with their feet deteriorates. So it seems that this may be a factor that's increasing the risk of falling for some individuals.
So, can we learn anything from this? Mackie says it may be a good idea to change footwear, cast away those walking shoes with lots of padding, and try something that gets your feet in better touch with the ground.
Okay, Mr. Brown, we're going to go over to the kitchen counter.
Yep.
Howard Burrell has fallen 5 times in the past 4 years. So far, he's been lucky. No broken bones. Now he's trying to avoid falling again.
Now the next one is just shifting your weight, Mr. Burrell. Shift over to the right.
Reluctantly, Howard is trying to strengthen his muscles. Reluctant because he's petrified to get out of his chair. But exercises are the #1 prescription doctors make for wobbly patients.
Forward, to the side.
Our results suggest, again, a control of side-to-side motion is maybe most important, so people can do exercises which stress the balance system in that direction. For example, shifting their weight from side to side, or standing on one leg, or walking heel to toe along a line. These sorts of things might be useful.
Lift your feet.
Exercise can also restore confidence that a bad fall can pull out from under an elderly person.
Confidence is what you need after you've been down. And confidence is a thing that's hard to get.
For an elderly person, if they get into a lifestyle of just sitting in a chair and not moving around, it's very serious. It's bad for bones, it's bad for joints, and it's bad for muscle, and there's a lot of wasting that can go on if they adopt a sedentary lifestyle.
Now, I have so many patients who do not want to use a cane. They don't want to be seen with their cane because it's an admission of the getting older. But in fact, I say to you, do you wear a safety belt in your car? Of course you do. Well, you wear your safety belt when you walk. You carry your cane.
What about people who say, oh, I don't want to use a cane, that means I'm an old codger?
I'm not embarrassed about that. I am an old codger, I admit it. I've lost a lot of things in my life here with this happening, and it hurt me. But I can't help it. It's better to be hurt that way than hurt some other way, than to go down and break a shoulder or something like that.
80% of all falls happen in the home. So if you're having trouble with your balance, there are some things you may want to try. Keep any loose mats in the house firmly in place by using double-sided tape. If you've got slippery floors, try using non-skid wax. And make sure loose cords from kitchen appliances and telephones are tucked out of the way. Medications increase the risk of falling by 300%. If you think the drugs you're taking may be making you dizzy, talk to your doctor. A little prevention can go a long way to safeguarding your independence. For The Health Show, I'm Erica Johnson.